At the end of the line, autos end up in the recycling center, or junkyard, as we used to call it. But with people, particularly with numerous children, they look forward to living out their golden years, fawned on and spoiled by their adoring children. But it doesn't always turn out that way. For more than 1 million people, the nursing home is the end station. According to the CDC, as of 2014, there were 1.4 million people living in 15,600 nursing homes in the United States. 69.8% of these homes had for-profit ownership. That is to say, entrepreneurs are making money off of the miserable circumstances of helpless elderly people. Residents receiving care in for-profit nursing homes are almost twice as likely to experience health issues caused by substandard care, compared with clients living in not-for-profit facilities or in homes in the community, according to a new report in the journal Gerontology. The researchers, led by Lee Friedman, Associate Professor in Environmental and Occupational Health Sciences in the University of Illinois at Chicago School of Public Health, also found that community-dwelling adults 60 years old and older who need assistance with tasks related to daily living, but do not live in a nursing home, had the fewest number of clinical signs of neglect compared with those living in any type of nursing facility. We saw more and more serious diagnoses among residents of for-profit facilities that were consistent with severe clinical signs of neglect, including severe dehydration in clients with feeding tubes, which should have been managed, clients with stage 3 and 4 bed sores, broken catheters and feeding tubes, and clients whose medication for chronic conditions was not being managed properly. Adults 60 years old and older who needed help fared the best when they were living in the community and not in a nursing facility. Because a study of 2,000 nursing facility residents indicated an abuse rate of 44% and a neglect rate of 95%. According to long-term care ombudsman programs in 2003, there were more than 20,000 complaints of exploitation, neglect, and abuse coming from nursing homes and assisted living facilities. The most common type of abuse reported was physical abuse. No matter how glossy the brochure or attractive the website, once a person is into a nursing home, they settle in for a life of neglect and abuse in many, many cases. How can the industry get away with this? Nursing home residents are among the most frail Americans. In 2005, nearly half of all residents had dementia, and more than half were confined to a bed or wheelchair. In 2004, nearly 80% of residents needed help with 4 or 5 activities of daily living: bed mobility, transferring, dressing, eating, and toileting. When people are frail and helpless and don't have any children who care enough about them to care for them in their own homes, they can end up in a nursing home where it's very easy for the staff to push them around and hurt them. As their operators sometimes say themselves, they're selling a product nobody wants to buy. But if people have some really miserable, ungrateful, worthless children, they can easily end up in one of these facilities. You have increased alternatives like assisted living and other ways for people to stay at home, said Ruth Katz, Senior Vice President of Public Policy at Leading Age, which represents nonprofit senior service providers. When people find community alternatives, they use them whenever possible. Anything, please, but a nursing home, as reported in the New York Times. And as the demand for bed sores diminishes, nationally 200 to 300 nursing homes close each year, Dr. Castle said. The number of residents keeps shrinking too, from 1.48 million in 2000 to 1.36 million in 2015, according to federal data. That's Nicholas Castle, a health policy researcher at the University of Pittsburgh. As the really bad reputation of the nursing home industry gets around, more and more people are saying absolutely no way. So nursing homes tend to close from year to year, and there are fewer people subjected to this abusive environment. On average, a nursing home stay with private room costs $253 a day, $7,698 a month, or $92,376 per year. This is a lot of money. More money than a lot of people make in a regular job. So why in the world would children put their parents in a facility with a 44% abuse rate? Enter the worthless child. But mark this, there will be terrible times in the last days. People will be lovers of themselves, lovers of money, boastful, proud, abusive, disobedient to their parents, ungrateful, unholy, without love, not lovers of the good, treacherous, rash, conceited, lovers of pleasure rather than lovers of God, having a form of godliness but denying its power, 2 Timothy 3:1-5. So yes, absolutely, their parents looked after them when, as little children, these people were not tidy in their toilet practices, needed assistance eating, and were often awake in the night. But instead of remembering this and showing some gratitude, they get to being all ungrateful, unloving, disobedient to their parents, scorning their parents, loving the cash rather than the parents. In one case, there was an elderly lady who was pretty well off, had a nice house, nice Toyota Camry. She fell down and was in the hospital for 5 weeks. When she got out, she found that her daughter, with the power of attorney, had sold the house, sold the car, and hooked her up for a place in the nursing home. Setting aside enough money out of the accumulated funds that the elderly lady had to pay for the nursing home, and spending the rest on a Lexus SUV and luxurious clothes for the ungrateful, greedy daughter. So how can you spot the worthless child? When their parents get old and frail, you hear things like, let's put them in assisted living. They'd be much happier in a nursing home with other people around than staying at my house. Oh, Mom soiled her diaper. Pay someone else to clean it up. Dad can't eat on his own anymore. Why should I waste my time feeding him when I can get someone else to? Completely forgetting, completely ungrateful for the wonderful things that their own parents did for them when these people were infants and small children themselves. And sometimes when these worthless children come to visit their frail elderly parents, they bring along some worthless grandchildren. How do you spot them? Either they spend their time sleeping when they're around the grandparents, or doodling on their smartphones. They don't make that call a minimum of twice a month to the grandparents with interesting stories about what's going on in their lives, questions about what the grandparents are doing, at least a half hour, twice a month. They don't make the calls, they don't make the visits, and when their parents tow them in, when they can bring them along, these worthless grandchildren, they sit there totally oblivious to their wonderful grandparents. These worthless grandchildren, or zeros, only call the grandparents briefly when they get a cash gift, never offer to help their elderly grandparents, and, as pictured, just lay around oblivious to what's going on when they should be making interesting conversation for the grandparents. Obviously, a zero doesn't mete out poor treatment only to his grandparents. Even with his own parents, he is, or she is, disrespectful. Failure to respond to text messages. No interest in helping out with anything. Just in it for the cash. 'Cause they learned it all from watching their own parents. So guess what will happen when the zeros grow up and their own worthless parents need some help? Train up a child in the way he should go, and when he is old he will not depart from it. Proverbs 22:6. The zeros have been trained up by watching their own parents neglect the frail elderly grandparents. So when the zeros grow up and their own worthless parents are elderly and frail, they'll perpetuate this cycle of abuse and neglect. As the fifth commandment puts it, honor your father and your mother, so that you may live long in the land the Lord your God is giving you. Exodus 20:12. You don't want to rot in an abusive nursing home yourself once you get frail? Make sure your parents don't have to do it. And teach those children of yours, the grandchildren, to treat their grandparents with love and respect. They won't forget it later on when you're in the same situation. So get things off to a good start, ensuring that you address your father as sir. If he wants you to do something, come running. If you ever catch your parents doing a task you could do, have them sit down and rest while you do the work. In your spare time, weed the lawn, dust the furniture and picture frames, and insist on cleaning the bathrooms. And if your parents are working on advanced degrees, volunteer to type any papers for them. Read the book assignments and summarize the contents. By the time a girl is 8 or 9, she should be running the kitchen, doing all cooking and other food preparation, and all the children should team up to set the table and do the cleanup. Because small children are closer to the ground, they should at an early age take over all weeding and garden work. As they grow up, let them learn to check auto oil levels and inflate tires, and if they show some ability, wash windows. Because your relationship with your parents is what you make of it. If you want to be disrespectful, greedy, unkind, unloving, you'll notice it in the way that they feel and the way they look in those family pictures, which you'll have around long after your parents have passed away to remind you of how you treated them. If you treat them really well, they'll be really happy. And if you absolutely insist that they not do work that you can do, they'll last longer. When they come home from a tough day at work, if it's a paradise, if they're thoroughly waited on and pampered, you'll notice it. They'll have more energy. They'll be happier. Obviously, if you treat your parents kindly, they'll do the same thing for you. And then they'll have some really happy memories. Later on, when you get older yourself, you'll be pleased with the rewards from your own children. So do not be deceived. God cannot be mocked. A man reaps what he sows. But let's say that you're absolutely dead set on disrespecting your elderly parents and putting them into a nursing facility where they will be neglected and abused. What happens then? The eye that mocks the father, that scorns an aged mother, will be pecked out by the ravens of the valley, will be eaten by the vultures. Or in modern language, get some horrible disease like cancer, get stuck in a nursing home yourself later on. I knew just such an eye that insisted on mocking his father, neglecting his parents, being unkind to his aged mother. The Lord was not ignorant of these happenings, so the angel smote him with the nasty case of leukemia. He was fatigued, he was dragging, and he got on these blood treatments to remove the bad white cells and replace them with good white cells. One time while he was having his leukemia treatments, he had a drug reaction and ended up getting pulmonary fibrosis or iron lung out of it. He doubled down and continued to abuse and neglect his elderly parents. Now he's dying a painful death, gasping for breath. All because he decided not to comply with the very reasonable conditions of the fifth commandment.